Hello, my name is Dr. Sam Hai. I am an internal medicine doctor. Thank you so much for watching and welcome to Raw Talk. This is episode number 47. Raw Talk is unfiltered and unedited. I give you my thoughts and opinions on health. In this episode, I will be talking about the FDA. What if the very agency that claims to protect your health has actually been quietly helping to destroy it for decades? I'm talking about the FDA, the Food and Drug Administration. To most people, the FDA is the gold standard for safety and regulation. If something gets the FDA's approval, we assume it's been tested, vetted, and deemed safe for our families. But the truth, the FDA is not a health organization. It's a business partner to big food and big pharma. And together, they've built a system that keeps you sick, dependent, and profitable for life. In this video, I'm going to break down the FDA's history, its corruption, and exactly how its decisions have fueled the obesity epidemic, diabetes, heart disease, and the modern health crisis. We're going to go deep with names, dates, and case studies so you can see how this agency has been instrumental in creating the chronic disease machine we live in today. How the FDA was formed and who it really serves. The FDA was officially formed in 1906 after journalist Upton Sinclair's The Jungle exposed the disgusting conditions of America's meatpacking industry. Public outrage led to the Pure Food and Drug Act, the first real attempt at federal food and drug regulation. That sounds noble, right? But from the very beginning, the FDA was influenced by the same industries it was supposed to regulate. Corporate lobbyists worked their way into the process early, making sure their interests were protected. Here's the revolving door problem. This is the constant back and forth movement of personnel between the FDA and the industries it oversees. For example, Scott Gottlieb, former FDA commissioner, is now on the board of Pfizer. Many former Monsanto executives have held key positions at the FDA, only to return to Monsanto later. Follow the money. Over 40% of the FDA's budget now comes from user fees paid by drug companies to speed up their product approvals. Just think about that. The companies that need FDA approval are literally funding the FDA's review process. That's like letting a defense attorney pay the judge's salary. The result? The FDA doesn't operate like an independent watchdog. It operates like a customer service department for the corporations that fund it. The approval process is designed for industry. How about prescription drugs? The FDA approves new drugs based on the studies companies choose to submit. Negative trials can be buried, and only favorable ones see the light of day. Fast track or priority review programs mean drugs can be approved with limited safety data and pulled from the market only if damage becomes undeniable. How about food additives and the GRAS loophole? GRAS stands for Generally Recognized as Safe. This allows companies to self-certify chemicals as safe without the FDA conducting its own safety testing. This is how artificial sweeteners, synthetic flavor enhancers, chemical dyes, and seed oil stabilizers have entered our food supply without vigorous oversight. How about medical devices? The 510K process lets devices be approved if they are substantially equivalent to existing ones, even if that original device was later found unsafe. Here's the bottom line. The approval system is not built for rigorous, independent safety evaluation. It's built for speed, convenience, and protecting corporate profits. How the FDA helped create the chronic disease epidemic. Let's first talk about the seed oil disaster. The FDA gave industrial seed oils like soybean, corn, and canola oil the stamp of heart healthy, despite a lack of long-term safety data and emerging evidence linking them to inflammation, obesity, and heart disease. This approval allowed big food to replace natural animal fats with cheap, highly processed, easily oxidized oils in nearly every packaged food on the shelves. How about the sugar cover-up? In the 1960s, the sugar industry paid Harvard scientists to shift blame for heart disease away from sugar and onto saturated fat. The FDA never challenged this narrative. Instead, they reinforced it for decades, leading Americans to demonize butter and steak while loading up on low-fat, high-sugar foods. How about the carb-heavy food pyramid? In the 1990s, the FDA, working with the USDA, pushed the food pyramid, making 6 to 11 servings of bread, pasta, and cereal the foundation of a healthy diet. Meanwhile, red meat and saturated fat were at the very top, labeled as foods to eat sparingly. This high-carb approach directly contributed to skyrocketing rates of obesity and type 2 diabetes. How about pharma first, prevention last? Instead of promoting nutrition-based disease prevention, the FDA focuses on pharmaceutical interventions. Rather than advocating zero-carb diets to reverse type 2 diabetes, they approve more drugs to manage blood sugar, locking patients into lifelong prescriptions. If you wonder why chronic disease keeps rising despite more doctors, more drugs, and more guidelines, it's because the system is designed to treat, not to heal. Let's talk about some case studies of failure and corruption. Let's talk about Vioxx. From 1999 to 2004, this drug was approved for arthritis pain despite early data showing increased heart attack risk. The result? An estimated 60,000 deaths before it was pulled from the market. How about OxyContin? From 1996 and onward, FDA-approved labeling claimed it had a low risk of addiction, despite knowing that opioids were highly addictive. This fueled the opioid epidemic. Over 500,000 overdose deaths since 1999. How about aspartame? Initially blocked in the 1970s over safety concerns, it was later approved after heavy political pressure, including influence from Donald Rumsfeld, then CEO of GD Surly, the company behind aspartame. These are not accidents. They are patterns that reveal the FDA's priorities: protect industry, downplay risk, and act only when public outrage becomes impossible to ignore. The triangle of corruption. Here's how it works. Big food makes cheap, addictive, nutrient-poor products. The FDA approves them as safe, often with misleading health claims. People get sick, developing obesity, diabetes, heart disease, autoimmune disorders. Big Pharma steps in with drugs to manage these conditions. Drugs that were approved by the FDA. And the cycle repeats. Every loop makes money for both industries, while public health keeps declining. Every part of the cycle makes money, except the part where you actually get healthy. How to break free. How to break free from the FDA influence. 1, stop outsourcing your health to government agencies. If the FDA says it's safe, your first thought should be, prove it. Number 2, eat foods that existed before the FDA, like whole, animal-based, nutrient-dense foods. No barcodes, no ingredient labels. Number 3, seek independent research. Look for studies not funded by the companies selling the product. Number 4, join communities outside the influence of big food and big pharma. Surround yourself with people who eat, think, and live differently. The FDA doesn't protect your health. It protects the profits of big food and big pharma. The sooner you accept that, the sooner you can take back control over what goes into your body. And the sooner you can break free from the chronic disease trap they built for you. Sorry about that, guys. If you want the roadmap, the accountability, and the daily support to do that, join us inside my Break the Food Matrix community. You don't have to fight this system alone. The link's below. I'll see you inside. Thank you guys for watching. Sorry for that interruption, but I appreciate you. If you want to follow me on Instagram for more content, my username is Sam_HiMD. Once again, guys, thank you. I love you guys, and I will see you in the next video.